Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hands, knees, hips, and spine. The exact cause is not known, but several things are thought to increase the risk of developing osteoarthritis, including joint injury and overuse of a joint when it's not had enough time to heal after an injury or an operation. In the United States, the enzyme serrapeptase is classified as a dietary supplement. Serrapeptase is useful for painful conditions, including back pain, osteoarthritis, rheumatoid arthritis, osteoporosis, fibromyalgia, carpal tunnel syndrome, migraine headache, and tension headache. The usual adult dose of serrapeptase is 10 milligrams 3 times per day, up to a maximum of 20 milligrams 3 times per day, and it's taken 2 hours after meals. Serrapeptase has to be taken for 1 to 2 weeks as an anti-inflammatory agent for its benefits to be noticed. Vitamin D intake is inversely associated with cartilage degradation among patients with osteoarthritis, and supplementation may have a protective effect. This is suggested by the analysis of data from the Osteoarthritis Initiative. So you want to get a 25-hydroxy vitamin D blood test to determine your levels and then supplement with vitamin D3 accordingly. Vitamin D3 works synergistically with vitamin K2. When calcium is uncontrollably deposited in the articular cartilage, the development of symptoms of osteoarthritis develop over time. Vitamin K2 plays the role of a transporter. It redirects the calcium into the bone and prevents its precipitation and adverse effects on the joint. The maximum amount of vitamin K2 that your body can absorb in a day is 300 micrograms. Therefore, any greater than this is not needed. Thiamine, vitamin B1, has anti-inflammatory and anti-hyperalgesic effects during CFA-induced arthritis. So after chronic vitamin B1 administration, you could get therapeutic properties for the inflammation. There's numerous forms of thiamine available. Magnesium is widely involved in human physiological processes like inflammation that play a major key role in the generation and progression of the disease. Magnesium deficiency is considered to be a major risk factor for osteoarthritis developing and progressing. So you want to take magnesium bisglycinate, and to determine your dose, slowly increase until stomach discomfort or diarrhea is noticed. Then reduce the dose slowly until you can determine your maximum tolerable dose without any stomach discomfort. Continue to take this dose. As magnesium is required by hundreds of enzymes in your body, daily supplementation can have profound benefits over time. Glucosamine sulfate might provide some pain relief for people with osteoarthritis. The supplement appears to be safe and might be a helpful option for people who can't take non-steroidal anti-inflammatory drugs. A 6-month trial of chondroitin in 162 patients with severe osteoarthritis of the hand showed that it may improve pain and function. One study of 45 patients with osteoarthritis of the jaw showed that those given glucosamine had less pain than those that were given ibuprofen. Deer antler velvet has been used to reduce muscle aches and pains and improve the way the immune system works and decrease inflammation. Deer velvet has also been used in people with osteoarthritis to reduce joint pain and to improve function. Laboratory and animal studies have shown that pillose, a protein found in antler velvet, has an anti-inflammatory effect. Antler velvet is also rich in chondroitin sulfate, collagen, and glucosamine sulfate. The properties and the makeup of the compound could make it a useful treatment in a variety of types of arthritis. Doses start at 500 milligrams twice per day of deer velvet powder, but can be increased to much higher doses if needed. Only get deer velvet powder and not a spray that's a deer velvet IGF extract, as this is useless for this condition. Some lab and animal studies have found that vitamin E may help to treat osteoarthritis by stimulating the growth of cartilage cells. Other studies have found that it also has anti-inflammatory properties, so make sure that you get a mixed tocopherol form of vitamin E for best results. Glutathione, known as the body's master antioxidant. Based on numerous studies included in the literature, glutathione and its precursor, N-acetylcysteine, have demonstrated significant protective effects in events of prolonged, exacerbated oxidative stress, such as is seen in chronic inflammatory musculoskeletal disorders like osteoarthritis. In order to make glutathione, your body needs selenium. 3 Brazil nuts per day can give you the recommended daily allowance of selenium. There's many other ways to increase glutathione, such as taking reduced glutathione at up to 1000 milligrams per day, taking N-acetylcysteine at 500 milligrams 3 times per day, and also using the herb milk thistle. New research has shown for the first time that omega-3 in fish oil could substantially and significantly reduce the signs and symptoms of osteoarthritis. Typical doses are 3 to 9 grams per day of a molecularly distilled omega-3 EPA-DHA fish oil blend. Type 2 collagen is one of the main proteins in cartilage. It's been suggested that taking collagen hydrolysate can improve the symptoms of osteoarthritis by stimulating your body's production of joint collagen. Typical doses for collagen can range from 5 grams up to 30 grams per day. Coenzyme Q10 exerts a therapeutic effect on osteoarthritis via pain suppression and cartilage degeneration by inhibiting inflammatory mediators, which play a vital role in osteoarthritis' pathogenesis. Doses in studies using CoQ10 have been from 300 milligrams to 500 milligrams per day. Alpha-lipoic acid can improve the clinical symptoms of patients with osteoarthritis and reduce the level of inflammation, which can be associated with the inhibition of various signaling pathways. Doses of alpha-lipoic acid are 600 milligrams, taken 2 to 3 times per day. Picogenol, it's a compound that comes from the bark of a European pine tree. It's a powerful antioxidant shown in nearly 50 years of research to reduce inflammation in patients experiencing osteoarthritis symptoms. Doses can range from 200 to 400 milligrams per day. Curcumin, which is found in turmeric. Studies have demonstrated that curcumin is clinically effective as a long-term adjuvant treatment of osteoarthritis. It has poor bioavailability though, but this can be enhanced by taking it with biopterin, which is a black pepper extract, or by frying it with coconut oil, ghee or butter, or by consuming it with omega-3 fish oil. Doses of curcumin can be up to 5 grams per day. MSM plus vitamin C. Available evidence from short-term randomized controlled trials shows that MSM may have a moderate effect in improving joint pain and swelling, as well as the general functioning and well-being in people with osteoarthritis. In one trial, this effect was greater when MSM was combined with glucosamine. MSM works synergistically with vitamin C, and a handful of studies suggest that vitamin C may also prevent cartilage damage associated with osteoarthritis. MSM doses can be up to 30 grams per day, but they can cause detoxification symptoms at first. So vitamin C can help reduce these detoxification symptoms, and also, starting with a low dose of MSM and building up slowly over time can also help your body to acclimatize and reduce any other detox symptoms. In theory, ginger can reduce the activity of several chemical substances that promote joint inflammation. Results from randomized control trials assessing its role in treating participants with osteoarthritis found that it has a high safety profile and can have moderately beneficial effects in reducing pain and disability. Boswellia, which is also known as Indian frankincense, may be helpful. Studies show that Boswellia may reduce inflammation and may be useful in treating osteoarthritis and rheumatoid arthritis. Boswellia can be applied externally as well as being taken internally. Several studies have shown that taking devil's claw for 8 to 12 weeks can reduce pain and improve physical functioning in people with osteoarthritis. One 4-month study of 122 people with knee and hip osteoarthritis compared devil's claw and a leading medication for pain relief and found devil's claw to be beneficial. You want to try and eat a Mediterranean diet, and you want to avoid all foods associated with inflammation, such as sugar, salt, saturated fat and trans fat, refined carbohydrates, omega-3 fatty acids like arachidonic acid, dairy, alcohol, and MSG.